Okay. Hi, everyone. Thanks for joining us today for what I hope will be a very exciting talk. So just to lay out sort of how this is going to work, I'm going to start by introducing our speakers, and then we'll go through our presentations in order. And then at the end, we'll open it up for a general discussion and question and answer session. So let me try to share my screen here. I think you can all see that, yes? So as Ulan mentioned, the theme for today is social capital and social media in pandemic times. And just to run through the authors here, if I can. Starting with myself, I'm an assistant professor of sociology here at Nazarbayev University. I previously held academic positions in Portugal, Egypt, Ecuador, and the USA. Before coming back to university life, I worked as a research methodologist at the National Center for Health Statistics in Washington, DC. That's actually part of the CDC, so my life is coming back full circle in a lot of ways. I've edited multiple volumes, including 2 on COVID that I'm going to talk about here in a minute, and some other titles I've listed there. And I'm also the series editor for the COVID-19 pandemic series by Routledge, which I'll also talk about here in just a minute. Our second speaker is going to be Dr. Heather Mello. Heather is a writing instructor, also at NU. She's an experienced language and social science professional who earned a master's in sociology from Georgia Southern University and a PhD in linguistics from the University of Georgia. She's taught language and social science courses in academic and community settings in the USA and abroad, and worked as a public health researcher and statistician for state and federal agencies. Dr. Mello served twice as a US Department of State English Language Fellow in the Volga region in Russia. And her research interests include the sociology of language, heritage languages, and language variation. Next will be Dr. Marilyn Plumley, who earned a PhD in linguistics from the University of Hawaii. I hope I'm saying that right. Marilyn can correct me if not. She's taught language and linguistics courses at both the undergraduate and graduate levels at universities in the USA, South Korea, and Egypt. She's currently a faculty member of the Writing and Communication Studies program at NU. Dr. Plumley served terms as the national president of the Professional Association of English Language Teachers in both Korea and Egypt. And she's had leadership roles in internationalization projects in both academic institutions and private sector international educational exchange organizations. Her current research interests are in multilingualism, it's ironic I can't say that, language sociology, and intercultural communication. Next up will be Noha Fikri, who's a PhD student in anthropology at the University of Toronto. Her research interests include the anthropology of food, ecological anthropology, and the anthropology of the Middle East. After finishing her master's, Noha spent 2 academic years teaching at the American University in Cairo. Guided by her professors, Noha takes it as a duty to train and help critical undergraduate students get published, and this collaborative chapter on which her talk will be based is her first attempt at that. I have to toss this in as an addition with a great note of pride that Noha was actually one of my undergraduate students when I taught at AUC, and we published something together. So I'm very proud to see that tradition going forward. Lastly, I just want to make a quick plug here and note that the speakers today have all contributed chapters to a set of volumes that I put together that are now available in print related to COVID-19. And those 2 volumes are now part of a larger COVID-19 pandemic series being sponsored by Routledge. I'm also the series editor for that, and I'm actively seeking proposals for monographs or edited volumes or even individual chapter contributions. So I will share a link for that information here, 1 second, in the text chat in case anyone is interested either in learning more about the series or interested in contributing to the series, or they're interested in reading the chapters on which today's presentations will be based. So with that in mind, I'm going to go ahead and start my presentation for today, which is about redefining the social prefix in pandemic times. So as a sociologist, I've long used the term social in front of many things. That's a trend that's slowly seeped into society, especially with terms like social media. But the pandemic seems to have really accelerated that trend. So terms like social media, social rights, social distancing, social responsibility are all terms that we've heard a lot more of over the last year. So my talk will briefly explore what this social prefix means, what putting social in front of other words implies, and I hope helps set the framework for the other presenters today who will be exploring those issues in more detail. So first, new questions have been raised about what social even means. Whereas before it tended to mean something in person, it has increasingly come to mean something done collectively, whether in person or virtually. Now that trend was already happening with things like social media before the pandemic began, but it's something that I think has really accelerated during the pandemic and spread into new areas. Another important note that I want to make before we start any of the presentations is about access. So many of the topics that will be addressed today assume some access to digital technologies. And I want to point out right from the beginning that access is not at all equally distributed. In fact, a statistic I always find shocking is that it wasn't until 2017 that even half of the world's population had access to the internet. And it's also important to remember that even that half that had access, there were additional barriers to use. So more than 80% of websites are in English. That's a clear barrier. And there are clearly wide gaps in terms of speed, reliability, and unfiltered access to content. So I just want to put that caveat out there. So with that caveat in place, I want to start by talking about social as a prefix or a modifier to the terms relationships and interactions. As the world turned virtual, social in front of those terms, relationships and interactions, has also taken on a new and in some ways accelerated meaning. Many of the major markers in our lives, weddings, graduations, even funerals, are now taking place virtually. That's something that's new for most of us. And even everyday events, hanging out with friends, family reunions, birthday parties, have also become virtual. What it means to be with someone has come to take on new meanings during the pandemic, whether that's with people in your geographic space, people we might be with physically in terms of confinement, and what it means to be with someone that we might not be physically in front of. This new, in quotations, form of sociality has brought with it both new joys and new miseries. For many people, contact with family and friends has become more frequent, especially as many of us have sought new ways to alleviate the loneliness associated with lockdowns. There's even been this trend of folks connecting with their long ago friends that they might not otherwise have contacted. High school class reunions have become more popular, reconnecting with old college roommates, and those long forgotten cousins have been brought back into the family fold. But new miseries have also started to abound. Zoom fatigue is a term that I'm sure we're all not only familiar with as a term, but as a feeling. So whereas meetings and interactions before provided some kind of respite from the blue light of a media screen, they now mean even more time in front of one. Average time spent in front of a computer has dramatically increased, again, with the note, at least for those of us with connectivity. So what it means to have a social relationship or a social interaction has taken on an even more virtual connotation than what it was already doing before. When we think about social in front of the term media, it's also come to take on new and accelerated meanings. Social media was already well on its way to becoming the dominant media before the pandemic. In fact, one problem is that people no longer seem to be able to tell the difference between media and social media, in part because the former, the media, is so often about the latter, social media, reporting on tweets, for example. What someone tweeted seems to be an increasingly common headline. One consequence of this is that influencers have come to replace experts as sources of information, if experts ever were. None of this is to defend traditional media, which already had a myriad of problems, especially in that they were often assumed to be experts, and yet they were most of the time just aesthetically pleasing individuals meant to entice a viewership who were often spouting opinion or speculation rather than some kind of expert analysis. An additional problem was the narrow range of perspectives offered by mainstream media, especially as corporate sponsor-dependent media has increased its stranglehold on how we get our information. Even in the US, where there's this commonly held belief that there's a wide spectrum of opinion, with CNN sort of being seen on the left and Fox sort of being seen on the right, the reality of that range of the political spectrum is that those two are actually much closer together than they are apart, especially when compared to the true spectrum of ideas and positions. The same could be said of the range of media in many countries. Back to the example of the US, though, whether we look at the right-leaning or the left-leaning media, neither hosts a socialist perspective, for example, something you could easily find in countries like Spain or Portugal. Neither is critical of corporatization, the free market, the destructive influence of speculation, the stock market, as one example. So there's a narrow range there. Traditional media was far from perfect. In some ways, social in front of media was supposed to be this great equalizer. It was supposed to mean that everyday folks, but also celebrities, politicians, and those elusive experts could now also have their voices heard. Unfortunately, that hasn't been the case. Instead, what has happened is that a group of influencers have come to dominate social media, and many of them for the same endorsement money-making rationale that drives so much of the non-social media. During the pandemic, this became especially dangerous as many celebrities, politicians, and influencers began promoting non-medical advice for medical issues. Perhaps the clearest case of social media gone wrong is that of Donald Trump, a case study I probably don't need to say anything about, but one clearly where misinformation and disinformation became the name of the game. One of the more destructive consequences of this rise in the reliance on social media has led to another transformation in what social means in front of other terms, like rights and responsibilities, and that's the topic I want to turn to next. Perhaps nowhere is the prefix of social seen the greatest transformation or augmentation in its power than before the terms rights and responsibilities. The idea of a social right or a social responsibility is certainly nothing new, but during the pandemic, we've seen their meaning twist, transform, and conflate in accelerated and unprecedented ways. What a social right or a social responsibility means was already fairly varied between different countries, cultures, and contexts. And while meanings have in some ways become more homogeneous, in other ways they've become even more polarized. If we start by thinking about the ways in which they become more globally homogeneous, then we need look no further than the example of masks, a topic that Dr. Miller will discuss in some detail here in just a couple of minutes. Whereas masks had long been seen as appendages of social awareness in many cultures, namely many Asian cultures, and others they've long been seen as instruments that invoke fear, xenophobia, and even hatred in others. We shouldn't forget that in many countries, for example, France, there were raging debates about covering one's face just over a year ago when the pandemic began. And while the reasons behind those debates were more fueled by politics and Islamophobia than by medical rationales, the practical outcome, the covering of one's face, remains the same. Since the pandemic began, however, covering one's face has come to be seen, at least by most people, as a sign of social responsibility, social awareness, and good old-fashioned concern for those around you. On the other side, and to use the same example, masks have also become one of the most polarizing issues in many societies. And it's here where we see the accelerated conflation between social rights and responsibilities and individual rights and freedoms, or even more concisely, the conflation between a right and a responsibility, be it social or individual. The USA stands out as a sad, and as a citizen of there, I have to say embarrassing, paradigm for this, as a place where we have seen masks not recommended, necessary for sound medical reasons, turned into flashpoints for political ideologies, accusations of the stripping of personal liberties, and flat out, quite literally, life-threatening conspiracies. The reasons behind this is in large part because there's been an accelerated confusion between a right and a responsibility and a misattribution of where the prefixes individual and social should fall. The ability to eat Taco Bell for dinner every night is a right I would enjoy, I have to throw in, but it harms no one other than yourself. The mandate to wear a mask in public spaces is a responsibility. Not doing so puts others in direct harm. Where this confusion between a right and a responsibility and this conflation between the prefix of individual and social goes after the pandemic, I personally think is going to be one of the more interesting things to watch. I also want to take a moment and talk specifically about vaccines, since that's probably the COVID-19 related topic most on many people's minds at the moment. This is a case where, again, the meaning of the social has seen quite a bit of tweaking during the pandemic. While the virus was spreading rapidly across the globe, and in the days when there was still no vaccine, the dominant narrative was that we were all in this together. The sense of a global social was enforced in headlines, and news of what was happening in other parts of the world, at least in terms of what was happening with the virus, was not an uncommon headline in any country. It seemed, emphasis on the seemed, that some sense of a strengthened global consciousness, an awareness of just how closely interconnected we all are, was gaining some speed. But then came the vaccines, and then it all changed. There's a saying that I like, and I'm paraphrasing it a bit here, but it goes something like, it's easy to be a socialist until you hit the lottery. And I think that metaphor is quite fitting for the vaccine situation in the world today. Many of the countries who'd been the loudest cheerleaders for a sense of a global social have suddenly, or maybe not so suddenly, become the leading culprits of vaccine nationalism. Canada, for example, has long been a champion of the idea of a we're all in this together mentality. But now that vaccines are available, they've already bought up more than 5 times the necessary doses to vaccinate their entire population. And sadly, they're not alone. In fact, in rich countries, which account for about 14% of the global population, they've already snatched up more than 50% of the global vaccine supply. The virus knows no borders, but it seems that vaccines most definitely do. Another point of note is how the thinking of the virus and the vaccine to help prevent it first saw this acceleration and this rhetoric of a social prefix, and now we're seeing this rapid return, this rapid acceleration of an individual prefix. So to wrap this up, we've long had impetus to think in social terms, be it at the local, national, regional, or global levels. The threat of nuclear war did much to push that line of thinking in the mid-20th century, and the environment has done much to push that in the early 21st century. I argue that the pandemic is giving us a push to think about the importance of this social prefix again. So my conclusion is really to pose more questions, or probably better stated, my conclusion is to raise social awareness by posing more questions. By better understanding how the meaning of the social has changed during the pandemic, we can begin to ferret out what was good and what was bad about those changes. And just as importantly, to ferret out who were what changes good for and who were what changes bad for. Does virtuality allow for more and better social connections, or does it somehow cheapen them, or does it just make them different? Is social media an equalizing force, or another way for science and fact to lose out to likes and retweets? Will we ever learn that even for those of us who prefer to be alone, we are not alone in this world, and that while individuality should be honored and celebrated, what it should not do is to negate social responsibilities? These are just some of the interesting questions I think we need to start thinking about more seriously, and some of the questions that our presenters today will begin to help us explore and unpack. So with that conclusion, I am going to turn this over to Heather for her presentation.
Okay, great. Thank you, Michael. Yeah, please. Please, Heather, yeah.
So I guess it's my turn. View, speaker, see myself. I would like to talk about my presentation. I am going to share my PowerPoint with you. I'm going to try not to kill you with it, but let's see. Can everybody see my PowerPoint screen right here? I always have to check to make sure
Yes.
that's what I'm working with my students. So my paper had a more limited scope, but it definitely touches on some of the themes that Michael was talking about, the social versus individual, the idea of access. Part of my paper, the research for my paper, came from comparing the discourse in one online newspaper that slants towards the liberal side of the political spectrum, CNN in the US, and one of them slants towards the more conservative side, Fox News in the US. So, however, if you had a television, I think there's much wider access than for the internet for that. And television reporting was pretty much the same. But my paper covers the idea of mass mobilization primarily. The idea here that the United States was not originally a culture, and we're generalizing when I use the word culture, that saw masks as effective prevention of illness. There are some ethnic groups and and immigrant groups, primarily from Asia, that did use masks before the pandemic. And, but generally, and if it wasn't 100 years ago during the 1918 Spanish flu epidemic, people weren't wearing masks. And the statistics that I can quote, I don't know what they were as the pandemic started in the United States, but we know that generally the US government's messaging in the very beginning of the pandemic was don't buy masks. They don't help prevent COVID-19 infection. We saw images coming from Asia that people were wearing masks. The second message that actually came during the pandemic in the very beginning, January and February, as January went into February and we started to get the first cases in the US, the idea was also don't buy masks because we didn't have enough supply in the US to take care of our health and other essential workers. By the end of my analysis for this paper, I think August 2nd is my last statistic. COVID researchers basically believed that we had reached 55% mask compliance behavior. Now, at the time, they were also saying that in order for us to reach some sort of herd immunity based on mask wearing, that we had to reach 95%. So we were still 40% off the estimated mark at that time. But something happened in between that January, February idea of, the US Surgeon General, Anthony Fauci, and other experts, epidemiologists saying, don't buy masks. They don't help prevent illness. More science came out. More science definitely came out of Taiwan, came out of South Korea, came out of China. And Western researchers had been doing their own research on masks and had turned the social media message, the media message, the message from local governments changed, and federal government, that masking can indeed prevent contraction of the coronavirus, not just for the self. And this is where it goes from the individual to the social, but masking, my wearing a mask would prevent others from contracting the virus. And I think my paper basically starts with that switch. Like, what was the importance of that switch within social networks to get Americans to change their cultural assumptions, their values around masks, and their behaviors around masks? And I want to spend most of my time just kind of looking at this next slide here. So from the abstract in my basic paper's assertion is that the adoption of mask wearing as a pandemic preventive behavior was facilitated by this huge group of mask wearing, this huge group of this army they actually talked about in the US of people who were making masks. So when the pandemic hit and people started hoarding masks and people started, we noticed that we didn't have enough supply. We have this great reserve and we're supposed to have enough supplies for pandemics. We simply didn't have it. This army of people who owned sewing machines, sewing clubs, women's clubs, men's clubs, Chinese American associations started making masks for healthcare workers. They started making masks for essential workers in their neighborhood. So this army had already been mobilized to make masks for the people we believed needed masks, who were, the healthcare workers, and people who are working with the public in the health area. And then as the message changed from masks are only good for healthcare workers to masks help me and help you, that army was already in place and they simply changed their mission. So the social networks, initially it was people in with their sewing machines making masks for healthcare workers. Then they started to make masks for people in close informal social networks. And then different groups, like this the mass, I can't remember, I'm trying to think, critical mass of people making masks switched, and it moved from just close people and healthcare workers to people outside and making masks for everyone and sharing them much more widely. So organizations started making masks and sharing them with others. And one of the things that this did, and one of the things called linking social capital, the idea of, can you trust the government and can the government handle this pandemic? Using the idea of this social capital is that when the citizens in a country come together to support the messaging that's coming out from the government, that actually increases trust in government. So as the citizenry of the United States comes together to help during this crisis, it helps the government, it helps people trust that this pandemic can be handled. And as that happens, people start trusting a little bit more. But on the other side of that, you know, the United States is a country of individuals who don't necessarily buy into that social, or they have a different definition of social, as Michael already said. As soon as states started talking about mandates and that everyone had to wear a mask, I link here to this idea of the mask as a symbol of tyranny, and you know, this man sort of making a mockery of mask wearing. That anti-mask, about a month after we start to see words in the different databases of language that I explored, where making masks and sewing masks and hand making masks and distributing masks starts to rise. About a month after that, we see that anti-mask terms also start to rise. And part of it, I would say, is due to three major variables. The United States went from don't wear masks, they don't help, and when you wear masks, you keep them from people who actually need them, to literally 2 to 3 months later saying, no, everybody has to wear masks. That's a hard, culture doesn't change that quickly. You know, we still have, you know, some cultures, some social behaviors and attitudes take very long times to actually change. So contradictory messaging, you know, Fox News in May was reporting the WHO from March and other agencies in the past saying, no, don't wear masks. So they were holding on to that reporting. Also, this is the idea of social capital and social networks. So if you were in a social network that had a change agent diffusing the idea of masks, someone who is respected and someone who is an influential group and someone who had a positive view to mask, if you didn't have these people in your network, then you are less likely to, you know, sort of change over. So that less positive interaction with pro-mask networks, that sort of less interaction between networks. And of course, American individualist attitudes, my rights, you know, my idea, it's not constitutional. Freedom, you know, is I'm able to decide what freedom is, rather than this idea of give me liberty or give me a death, you know, the idea of give me liberty and give you death. People didn't necessarily think about what was happening in that idea of social responsibility. So I have about 1 minute left. And I just want to comment on one of the definitions that was used by Rogers in his book on diffusion of innovations. He actually talked about the fact that when an innovation diffuses across a society, it doesn't actually diffuse based on scientific studies. It actually is more likely to diffuse based on positive behavior from people in your social network. So when you are maybe trying to influence people, or you're seeing this influence effect about masks, try to think about different ways to influence people, but throwing stats at them may not be the only way to reach them. But you wearing your mask and you making it seem like the best thing to do is probably more influential than all of the statistics you might be able to throw at somebody who is very resistant to the idea of wearing a mask. So that's my research. Thank you for your time and your attention. And I will turn it over now to Dr. Marilyn Plumley.
Yeah, Ulan, all right. Just go ahead, let me share my screen here. Here we go. Okay, so
Right.
can everybody see my screen?
Right. We can see it. Yeah.
Okay, great. Okay, so my the title of mine, as you see here, is The Sites of Silence, Deaf Online Communication in the Time of Corona. And this was meant as a play on words, sounds of silence, and in other eras. So I kind of was playing on the words. Basically, what I looked at was the communication in a, excuse me, I'm going to have to, it's not going down. Hold on one second. Oh, my slides. There we go. Okay, sorry. Yeah, right. So basically, I'm looking at this deaf community in, or it's not a community, it's members of the deaf community who created a WhatsApp group at the very beginning of the pandemic. And I was invited into this group. And after being in it for a few days or a couple of weeks, I realized that I was having access to insider access by invitation. I hadn't started out to do a research project. And I realized I had this amazing access to this unique minority community. And basically the thrust of mine as it relates to the whole series that Michael has put together is it's looking at how one particular community reacted to, adapted to, and made use of the resources available to them during the pandemic. So of course I have to say at the outset, deaf people they are a minority. They are primarily a linguistic minority. People often see them as part of the disabled community, as they say in Russian here, invalids, which is a word that is very uncomfortable for a lot of us that are used to the English language, but the standard Russian term is invalid. But let's say a member of one of the disability communities. So it's a linguistic minority, but it is also a minority within the larger disability groups or disability community because of the access to language and to a shared language. And of course, it becomes a minority in more ways than one due to the attitudes of the general hearing society. So basically here, I just put up to kind of give you the visuals, and deaf community largely relies on, obviously, on visual symbols, visual language. So there's a lot of emphasis within the WhatsApp group on visual images, much more, I would say, than in a WhatsApp group between hearing people that use a lot more text. Okay, so basically the setting here is this group of deaf people in Kazakhstan. There were 9 people in my group, plus myself, who had been invited in. They had already existed, and then they invited me in a couple of weeks after they started this group. It was of mixed ethnicity, mixed national backgrounds, geographic origins from within the country. But at the time that this group existed, they were all living in Nur-Sultan, the capital city here of Kazakhstan. And these members of the group were all friends who socialized with each other offline before the pandemic started. Of the 9 deaf members, only 7 actually contributed on a regular basis. 4 were women, 5 were men, age range, as you can see, from 22 to 23. My status within the group, as I said, I was an invited member. My relationship with them was that one of the members invited me in, the founder of the group, in fact, invited me in, and I had socialized a couple of times with, or maybe a couple, 3 times, with 4 other, excuse me, 4 other members of the group. And the reason they accepted me so readily, I'm an American, I don't speak Russian, I didn't at the time and still don't speak Russian Sign Language fluently, but I have been an interpreter in a previous life, and I have been around and mixed with deaf communities in many different countries wherever I live for a number of years. We can say it's going on 40 years almost. So they recognize that I'm a deaf-friendly and a you could say an adopted member of deaf world. So they readily accepted me as a member of their group. Basically, I had 2 research questions when I started this. First of all, what are the responses and the reactions to the virus, the pandemic situation in this community of urban deaf. And we have to emphasize these are urban deaf. They're all educated at least to high school graduation level, or we could say 10th grade, 11th grade, as is normal in Kazakhstan for deaf people. One of the members is actually a university graduate from a Russian university, but basically urban. They're living in an urban environment and they're educated and literate. And then I also wanted to know what is specifically deaf about, what responds to deaf norms, or what corresponds to what I know to be deaf norms that I've experienced in all the other countries where I've lived. And what are the deaf norms of this deaf Kazakhstani group? And here's some basic statistics. So I was in the WhatsApp group and I collected data from the period of the 28th of March until July 4th. And in that period, that's roughly all of April, May, June, so 3 months and a bit, over 14,000 messages were generated. Sometimes there would be several hundred messages on one day. They would be, messaging back and forth, because during the strict lockdown period, they were not able to meet. Later in June, things loosened up a bit. And as we got into July, things loosened up a little bit here in Kazakhstan. So people were able to socialize, outside their homes. But in the March, April, most of May, we were under pretty strict lockdown conditions. And so just the breakdown of the messages, there were almost 9,000 messages, which turns out to be 63% of the 14,000 were actually written in Russian, in text messages. Occasionally they would use Kazakh words, but as far as I know, none of them are fluent in Kazakh. So just a few words like Rahmet and Asbolsin, or a few words like that would be used in Kazakh. But basically they always when they used text, they used Russian. And then the remainder of the messages were in some kind of multimedia format. They were still images or filmed images, or very interestingly, of course, they used sign language messages. I was actually surprised that the number of sign language messages was not more than it was, and that 63% of the messages were actually in Russian. But it's easier just to type in a sense than it is to hold up the phone and generate the selfie messages in sign language. So out of those, a little bit less than half were their own self-generated, you could say, selfie video messages to their friends in the group. And then there were a lot of messages that had been uploaded by some people somewhere that use Russian Sign Language in Kyrgyzstan and Russia. Kyrgyzstan and Russia were the most common, actually. Okay, so basically I had, after analyzing all of these messages, I found 5 themes that related to the pandemic and 7 themes that seem to relate to more specific deaf concerns, which you can see here. Now, the pandemic themes, I would say, are not that different than what would have been themes of anybody, anybody in the world, any other Kazakhstani or anyone else. The medical questions, what services is the government providing? What are the current lockdown rules? Is there going to be any kind of subsistence for unemployment? Am I going to be able to find a job? Am I going to be able to work at all during the pandemic? And of course, then the fear, the frustrations, the sorrow, the complaints, the suffering under lockdown, and the suffering of people who might be sick. And then theme 5, which I think is familiar to all of us who have now lived through this pandemic, there were attempts to engage in some kind of leisure activities and to socialize, and especially to relax a bit, maybe outside of our own homes during the COVID or during looser restriction periods, because the restrictions would tighten and then they would loosen and then they would tighten again. Over there on the deaf specific concerns, as you see that there's a lot of group solidarity, a lot of mutual support, affection. When anybody expressed that they had a problem, they would immediately, everybody would join in and immediately provide some kind of comfort and encouragement. Sometimes, brotherly, sisterly kind of, not criticism, but like, shape up, we're here for you, but you got to shape up and this is what you got to do kind of thing. It was also obvious, item number 2, that there were language and communication issues dealing with literacy on some of the published government, ability to decipher some of what the official government publications were, asking mutual help from each other on how to fill out forms to get their government subsidy. And so they would often, or the resource that they used was referring to other people within the group rather than asking a family member or someone that may be living in the same house. They turned to the group because deaf people help each other best when the family members don't know sign language. And then there was a theme. It wasn't very strong because in fact, normally the deaf people have a lot of issues with accessibility and misunderstandings with hearing people. But during the pandemic, they were mostly constrained and living in their own homes. So there were not as many examples of misunderstandings with hearing people, although sometimes they did mention it. And then, right, seeking help to, help for each other. I was very interested to see item number 5, that a few times issues came up where they were very much in group. They had expressed a lot of in-group solidarity among the group or anyone who was deaf. But there was also a very strong sense of, social responsibility and wanting to help people that were not deaf, maybe even people that they didn't know, but just someone who was in a difficult situation. So it was interesting to see that the deaf people, they felt themselves, even though they are a minority and even though they are cut off due to linguistic barriers, they did feel a solidarity with other Kazakhs and with humanity in general. And then of course there were miscellaneous topics, food and the kinds of things that all of us have engaged in that was not particularly deaf-centered, but it was, topics among themselves, and they joked and teased in their own kind of informal way. And a lot of that was in sign language. And then there was also reaching out. A very notable characteristic of this deaf group is they reached out to an international network of online resources in sign language or signed language. It's not always Russian Sign Language. Okay, so basically I'm going to jump here to the conclusion. I'm just going to show you that, and then I have a few images that I want to show you before we wrap up. I haven't received my time notification here, but basically.
Oh, I sent you already, Marilyn, several times.
Oh, okay. I'll talk real quickly and I'll let people look at the slide. Basically, I have a couple of points here from the conclusions that these urban resident deaf people in Kazakhstan conform to many of the norms of deaf culture elsewhere. Strong proficiency in sign language. They are also quite literate and use the local standard written language. Strong deaf in-group solidarity, reliance on information and entertainment as the most accessible resource rather than audio things. And they showed item number 5, a vivid interest, very, very strong interest in postings by deaf in other countries, especially countries that use Russian Sign Language. And of course, there were information gaps, as I just mentioned. And then the COVID-related responses, I've kind of highlighted that when I looked at the themes, but I just want to mention, basically the reactions to the COVID crisis were similar to non-deaf Kazakhstanis. They had apprehension, they had worries, they had questions. They wanted to relax when it was possible. And as I just mentioned, they had social solidarity with out-groups, with non-deaf. And now this is something I wasn't able to include in the chapter that was published in the book due to space considerations and Michael's strict editing policies. So, and Michael's laughing because he knows how much I fought him on this. I wanted to include images. So I'm just going to run through here, and most of them have Russian labels, but I've translated the titles up there in English for you. I'll just let you read them as I kind of flip through them. There's the international sources, and this one's related to deaf, the deaf masks. There were others, but this is a good image that I picked. Deaf resources, and interesting that the image on the right is from the KOG, is Kazakhstani organization of the Gluchi. G stands for the word deaf in Kazakh, or in Russian, Gluchi. So many of the KOG, the branches, whether it's the Almaty branch or the Nur-Sultan branch, they published images and information, and a lot of the deaf people would get their information directly from KOG. This is just one example. And then, of course, they posted, you know, like everybody else in the world, they were posting images of what their government, but it was very interesting. The way they talked about it was like, hey, did you see this today? This came out. So as I said, posting to each other within the group. I mean, as you said, there were 14,000 messages. Sometimes it was chat, but there were a lot of messages that were being sent by the government. And you can see here, coronavirus posts, and I've translated that for the people who are not here and don't speak Russian. Buses are not going to run, how many people got infected, restrictions this weekend. This, for the people who are not living in Kazakhstan, this big ball is the Expo ball. It's one of the symbols of the capital city. People died of pneumonia. That was part of the pandemic situation here. They didn't get tested for corona, but they died of what was called pneumonia. Oh, I think there's a typo. That's 473. I think it's, oh no, it is 47. Yeah, okay. Then there were the humorous images. We've seen these, we've all seen these, but they also are part of that, you know, that circuit of images that circulated around the world, the things you can laugh about how you live through this period. This one on the left is a very poignant story that I don't know this man. This is just a man in Kyrgyzstan, which is a Russian sign language using country. And it was posted by this man to his friends, and his friends posted to somebody in Kazakhstan, and those friends in Kazakhstan posted to somebody in our group, deaf group of 9 people, and it reached me. So this is an unknown person who was suffering, and he gave a very poignant message to other deaf people. So this is kind of an example. And here's this one, Sergey, whose name is Russian, but I think he's Russian. I think he's Russian, not Kazakh. And anyway, they said he ate shashlik on the 30th of March and he died by the 5th of April. A Russian deaf person, so they're very interested in this case. Then there were international posts from various countries. I didn't include them all. Today I just included one from China, one from Portugal. I think it's Portugal, maybe from Brazil, but in the Portuguese language. It's a deaf church service that's being advertised. Here's a funny one on the left.
Marilyn, I'm sorry.
They said in Belarus.
Marilyn, I'm sorry.
You have to stop?
Yeah,
Okay.
You almost 6
Okay,
fast. So
let me.
Yeah.
Okay. So just here's, I love this image. The last one on the right, it's a picture of a medical worker cradling Kazakhstan in her arms. And that's it. Thank you. Sorry to run over.
Yeah, okay. Thank you, Marilyn, for the great presentation. And our final speaker for today, Noha Fikri, please welcome. The floor is yours. Yeah.
Thank you so much. Okay, so I don't have a presentation to share, but I'll walk you through my chapter written with my students. So a year ago, I was teaching at the American University in Cairo, and I was teaching an undergraduate course, an anthropology undergraduate course titled Arab Society. And it has always been a challenge to teach this course to mostly Arab students, with few exceptions of international students. So how do we define Arab, and how do we engage with the concept without othering other people, without necessarily discriminating against people? How do we reflect on ourselves and others? These were all questions that I was trying to deal with in this course, in the syllabus, in the readings and everything. But my solution to that has always been an autoethnographic angle. So I would always ask the students to basically use their meetings with their friends, their social outings and everything to actually inform the assignments in class. But of course, this has been such a challenge in COVID. So what I was trying to reserve this autoethnographic quality online. So how do we do this? We ended up basically shifting the class to Facebook. And I'll tell you more about that. But the main argument of the chapter is that Facebook really offers a rich ethnographic ground for the current moment, but also for critical commentary on the social world in general. And in the particular context of Egypt, Facebook really plays a very crucial role as a moral police, so to speak, for society, in which the shared news updates, posts, images, and even memes are always trying to maintain and strengthen a boundary between an Arab self and an other. The other can be a rural Arab, it can be a European, it can be an Asian, it can be anybody, but there's always a self and an other, so to speak. So on March 12th, 2020, AUC, the American University in Cairo, decided to shift online. And we were advised to use Blackboard, Collaborate, and Zoom. And both are very unreliable for a large amount of students. So I had 30 students in class and a very unstable internet quality in Egypt. So it was very difficult to have a synchronous class. So we decided to, like, reflecting on what was happening, we were all really at this point in time spending so much time on social media. So we decided that, okay, we need then to take the class to social media. We created a closed Facebook group for all of us in which I host mini lectures, and then we would get posts and comment on them, get into discussions. And for the final essay or the final assignment, what they had to do is basically explore the social circles online. What is happening? What is the family posting? What are their friends posting? Why are they posting what they're posting? And what does it say about the Arab society? If this course is on Arab society, what does Arab society do online, so to speak? So basically, we were trying to also theorize Facebook, not just as an ethnographic ground, but also as a field site. So what happens when we conduct digital ethnographies on Facebook? How do we analyze what we see as artifacts without fetishizing these posts? So what I was trying also to do is basically push them to only use the posts of people they know, so that we can have a critical engagement depending on the lives of people and not just the posts alone, but how the posts are actually situated in the lives of these people, sociologically and anthropologically. And this was very exciting. But to give you a bit of a background on Facebook in Egypt, so it began as an exclusive virtual space for Arab youth and for young generations. And it was at that point very much known for courting, for explicit content, etc. And then in a very small amount of time, it became densely populated with Arab parents and Arab even grandparents who would connect on Facebook with distant members of the family and post your average cat videos every time and every day and share them with all the family members. So it really changed, like as a social space, it also really changed. And this is also reflected by statistics. So in the Arab social media report, it made the claim, or like it actually used statistics to indicate that in the time period between 2010 and 2017, we have 14 million new users on Facebook that added up to 30 million users in a given population of 96 million Egyptians at the time. And we know that this number has risen significantly, but we don't have accurate percentages or accurate numbers at this point at all. So as such, this hyper presence of the Arab parents on Facebook and the Arab grandparents on Facebook really gave Facebook a feel or a taste of an Arab home salon. And the salon in like Arab homes or most Arab homes is a room that is only for the visitors, basically for receiving visitors. And it is consequently where the informal but also very annoying small talk takes place. Usually very classist small talks, also morally policing what people wear, what people say, what people do in this particular home. So I was also trying to argue with the students that Facebook is actually the extension of this salon in the sense. And so what we did is basically focus on a different variety of posts, but most of them were under the genre of memes. And memes were very important for the generation of my students in specific, who are now in their very early 20s or even 20. And it was also building on Professor Ryan's introductory chapter in the volume, where he actually conceptualizes COVID not just as a pandemic, but as a syndemic, to basically describe the intervening social and health dimensions that we're now exploring. And taking this one step further, and the title of the chapter is basically COVID the Pandemic. So I'm trying to explore with the students how the COVID is actually an enunciation of this health society nexus through the particular genre of memes. So what are memes? They originate in, or they were originally developed in biology and then got conceptualized very solidly in social sciences and by media scholars. They basically describe the propagation of items such as jokes, memes, videos, and images from person to person via the internet. And how they differ from virals is that virals are actually only one cultural unit. So it's a single post or photo or video that is circulating. But by contrast, memes actually change with every share or with every edit. So they're continuously recreated, so to speak. So it's not a single cultural unit, but can be a video that is edited with a new caption, with a new layer, so to speak. So there is also this creativity in memes that is not in virals. And then the primary of Egypt and Arab society is that we have a reversed internalized Orientalism. So given a historical, like a history of colonialism in different parts of the Arab world, we have something called عقدة الخواجة, which is basically translates into a foreigner's complex. And that is denouncing everything Arab in favor for everything Western. The thought, the music, the habits, everything. But this has really shifted during the pandemic because people began commenting on the rising numbers in the West versus and at that point were still a bit lower numbers in Egypt and different parts of the Arab world, and also commenting on, for example, Egypt sending aids to European countries. So people began reflecting, oh, we're not that bad after all, maybe we're not that inferior. They began really reflecting on this very, very carefully. And then we have internalized inequalities or internal inequalities, in which posts would be basically making fun of people who are still going to work, yes, because they don't have the privilege of quarantining at home or working from home, or people basically washing their face masks and hanging them to dry, and people would be like, this is not how it should be done. You should buy disposable masks. So again, there were this classist undertones and overtones in most of the posts. And we also tried to use Dr. Kobler-Ross 5-stage model of dealing with grief to basically provide some kind of a timeline to the posts on the pandemic. So we have denial, anger, bargaining, depression, and acceptance. And just to conclude, so perhaps the pandemic has not drastically changed global power dynamics or global power in general, but it has really offered a space for people to reflect, to engage in new dialogues, in new conversations on our place in the world and comparisons. So this was very, very important in the case, again, of the Arab world in Egypt in specific. And that also, we think that this is a moment in which digital ethnography is really the superstar, because this is where most of the social is really taking place as connections, as interactions, etc. But also that memes are much more than ethnographic artifacts, in the sense that they are also, we take them as products or modes of knowledge production, in which there's a continuous conversation, adding new layers and recreating the meme with every share and edit. And that's it. I think I'll stop here for purposes of time and to allow time for the discussion as well.
Noha, I think you still have time. Please, that's fine. If you would like to.
Thank you so much.
Yeah,
yes, I was also thinking that the assignment was excellent in that when we had the final Zoom session meeting with all the students, they all reflected on how this single assignment was actually an Arab society course on steroids, because we got a chance to really zoom into social media, into the things we share, but also the things we take account of, and how they basically document an ever-changing Arab world that can be contradictory, communal, loving, but also toxic. And that I think we all grew through this assignment and through reading through the posts and looking at them through an ethnographic lens. So yeah, that's it. Thank you so much.
Oh, welcome. Perfect timing, Noha. Thank you very much. Okay, so Q&A session is open. Please, you can ask questions. So my suggestion, please raise your hand and or type your question in the chat. So it's up to you. So yeah, I mean, in the Zoom chat, there is option to like hand raise, you know, so it will be easier for us just to look to the chat room and select. Okay. I don't, but yeah, please, Malgorzata, please.
Yeah, thank you. That tricky hand raise thing always eludes me. Where is it? Wait. Hi, everybody. That was fantastic hearing all three presentations and Michael's intro. What struck me in listening to it was that we have now recognized that these social media sites are not necessarily places for dissemination of information, because that may be wrong, but instead they have become, as Noha has said very eloquently, kind of like salons, where the feelings are much more important. And certainly with Marilyn's statistics there, I was struck that really this was the site. Yes, there was information exchange, but it was more the site to take care of the attitudes and feelings. And even with Heather's, I don't know if that was a factor in those communities, but certainly your closing words that, you know, mask wearing will be more influenced by the attitudes toward it. So I guess it's just a general reflection and a question for all of you. Is that an accurate assessment of how we are now viewing these places, these virtual places, that it's not necessarily a place for good information, or we don't trust it, or maybe it is information, but it's up for evaluation still. But most definitely, it's kind of a place for us to retreat to deal with emotional issues around COVID.
I can say for the deaf group, I mean, a huge percentage of the things that they downloaded were so-called humorous. I mean, I didn't necessarily always think that they were humorous, but you know, somebody thought they were humorous, and sometimes other people didn't think they were humorous. They say, huh? But they would use it not as an information, but they would use it to just help people relieve their stress. So again, the name of the group was Anti-Stress, and so yeah, it was social, obviously, but also it was used to download a lot of things for humor, which is part of that salon atmosphere, I guess you could say. Noha, I see Noha nodding her head, yeah.
Yeah, definitely. I definitely agree. So yes, at the beginning also we were really struggling with this. Is it information? Is it not? And then is it even rumors? And then we decided that we're interested in the sociology of what is happening, and information sharing, whether it's information or the truth, is not our question.
I actually find it concerning that I think people are trusting it. And I think that that's become really problematic. I can't remember the statistics off the top of my head, but some surprising number of people are now using social media sources as their primary source of getting information. They're not watching the news, they're not reading the newspaper, either in print or online, but they're checking Facebook memes, or they're getting something from a group WhatsApp or some other source of disinformation or misinformation. I think more people were listening to Donald Trump than Anthony Fauci. I don't want to believe that that's true, but I do believe that that's true.
My research didn't look at social media specifically. I looked at online newspapers, and then I looked at a corpus of other online newspapers and compared these two methods. However, even the online news differed. CNN, and in the very beginning, CNN and Fox were reporting the same things, what the Surgeon General said. And then around April, they started to diverge, and CNN kept a very pro-mask line, and Fox News started to report not just, you know, what maybe the Anthony Fauci was saying or the Surgeon General was saying, but then they would feature, you know, a race car driver or some of their pundits who were anti-mask. And so even the news is not necessarily a source of accurate information. And that's the problem as well. And half of the news was reporting about social media. What did Trump say? Yes, so, you know, the news has become a site of watching the salon. It's not the salon, but it's where you watch the salon. So.
Okay, thank you. Gavin, please. You have a question.
Hello, everybody. Thank you. Thanks for organising this, Mike, and thanks for all the presentations. Really excellent. Really enjoyed them. I think my question is mainly for Heather, but it probably touches on some of the issues that everyone was referring to in terms of people being siloed in certain information environments. So, I mean, I was just interested in this idea of, the mask wearing is fascinating. So what you're talking about is a sort of shift in behavior. You try to explain that shift. And I was just curious about, is there some literature or some way to frame this comparatively in terms of, there's lots of examples of people telling us or governments telling us that if we were to wear certain things, it would be in our interests, right? It would make us healthier or allow us to lead a healthier lifestyle. Sort of government interventions. I was sort of just curious as to, is there a specific dynamic here about the public nature of wearing masks? So if you were to compare it with a campaign to make people wear condoms, for example, that might be, well, that's sort of private. People are not so publicly exposed in terms of their choice. So if I'm surrounded by people who are telling me that, wearing a mask makes me look like I don't know, a weakling or a dweeb, or, it shows me as being some subservient person to the government. I've got this feeling that I can't break out of that because I'm presenting myself out there in the world by wearing the mask. So is there something specific about mask wearing if you compare it to other types of government interventions? So another thing I'm thinking about is seatbelts, wearing seatbelts. And here I've got a specific question as well, just to follow up very quickly. So in the Republic of Georgia, in the former Soviet Union, where I was living for a while, before 2003, nobody wore seatbelts. And it was sort of considered, again, because it was a signaling device in terms of self-presentation, that if you were masculine, bravado, you get into a taxi, if you tried to put a seatbelt on as the passenger, the driver would, say, what's your problem? Why are you putting a seatbelt on? And then suddenly around 2005, 2006, people started wearing seatbelts. And now, one of the theories of that is that it was just driven by sort of punitiveness from the government, where they really started to fine people. They really started to punish people for not wearing the seatbelts. And one of the theories was that basically this gave people an out, if you like. So people who had this sort of masculine belief about themselves, actually they understood that wearing seatbelts would be a good thing for them and make them safer. But because they were so embedded in this, in the self-presentation and wanting to signal to the people who meant something to them, their social circles, that they still belonged to this bravado culture, that they couldn't break out of it. But having this punish used to say, well, actually now I have to change my behavior. So I was just wondering, is there any evidence of that? So I suppose there's two questions there really, which is was there any effect in sort of terms of punitiveness, fining people, creating these negative incentives not to wear a mask, and also about if you compare it to other types of things that governments ask us to wear. So sorry for the long question. Thank you. I think that's mainly to Heather, but obviously it touches on other people's points.
I'll do my best to answer, and a lot of my answer is going to come from my literature review, because my methods themselves did not look necessarily, but some of my corpus actually dealt with your topic. So in my literature review, I looked at pandemic preventive behavior studies out of Taiwan, out of France. And what was really interesting was in Taiwan, even though mask wearing, like their rates of mask wearing were very high, 78% according, I think. However, men were less likely to wear masks, even in Taiwan. And you were more likely to wear a mask if you felt yourself more at risk, whereas Western studies that talked about pandemic preventive behavior didn't even touch on masks. However, in the United States, and I talked about this a little bit in the paper, masks were actually illegal after 1918, well, starting in the 1860s and on, excepting the 1918, because people wore masks to commit crime, to conceal their identity when they were, doing political subversion, and during, like, when the Ku Klux Klan or different racist groups were demonstrating. But the idea that of the masculinity, I didn't put it in the paper, or masculinity or certain behaviors that people know is good for them, the AIDS epidemic and condom wearing. And there were a lot of articles, in fact, most of them were editorials, excuse me, that talked about how there was a direct correlation between this idea of I'm a man, I should feel a certain way, I should be able to experience certain things, and so I'm not going to engage in this behavior even though I know it should be good for me. So definitely, your first question was something about masks, wearing masks and concealing the face. I read a few articles that actually talked about the idea of the open face and being able to see the open face as something that humans are naturally drawn more to, and that hiding has always been associated with some sort of furtivity or secretive behavior. But I think Noha can kind of talk a little bit more about that, maybe from a different, maybe religious perspective, as part of, a society where mask wearing is seen positively, or not masking, but face covering. I can't remember your other question.
I mean, just to clarify, Heather, I mean, so basically my idea is something like, well, if wearing or not wearing something is very much wrapped in your self-identity as you present yourself to other people, then if it's a particular item of clothing for you to break out of, there's a particularly difficult obstacle to it because it is so public, if it is related to your identity. So if this mask wearing got constructed in this way that it's all about masculinity and bravado, or it's part of the culture, or, it's also freedom.
In the US, it was associated with the idea of freedom, and you're right, and that's the problem where the networks are not meshing, is those who define it as cooperative and helpful, and you see me wearing this mask and it means that I care about others, and others who say, I see you wearing that mask and I see weakness, and I see fear, and I see a puppet, and I see a sheep. So definitely, but I wanted to give Noha a chance to talk about masks. Specifically. About her background too. So
yeah, I think it depends so much on the context, because in the context of Egypt, basically what was happening is that at one point we also had like a surge of posts and memes, basically comparing masks to the niqab, which is a form of veiling, of a face veil, including, so nothing in the face shows except the eyes. And people were saying, well, see, niqab has been true and has been like trying to see the future. It was jokingly, but not so jokingly, because there were some people who were actually enjoying the conversations, and others thought this was very, very backwards. So it's interesting because also in the context of AUC in specific, we also had, like the American University in Cairo, we had at one point a very intense debate on whether niqabi students would be allowed in the university or not. And there has been, so part of the move against, so that at that point, the administration was banning the niqabi girls from being on campus with their niqab, with their face veil. And so some students were actually demonstrating against this by wearing masks in class. But this was again like 20 years ago or something. So, but now nothing much is happening other than just the fleeting moments of jokes on niqab regarding face masks.
Yeah, can I maybe add a point? I agree. Yeah, thank you, Noha. You, I think, I don't know, in one of my presentations for history department, I was talking about Islam and in pandemic situation. Actually, it's interesting that at the beginning, I saw some Muslim Instagram, some Dagestani Instagram pages on Islam where they made translations of some lectures, some dawahs from Arabic to Russian. And it was interesting to see that some people were telling like this is like a punishment from God, and this actually like a call back to religion, that I mean the whole world now is wearing niqab, women and men, they're not touching their hands. So so it's people like keeping distance, people wearing like long sleeve clothes to protect. This is actually like, the whole world, I mean the world was like, the Western world was against Islam, and look how God is great, and now like Westerners, they look like Muslims now. I mean, they were forced. And back to giving points about masculinity, it was interesting to see like my impression that for example, handshaking is a sign of masculinity, right? And Donald Trump is one of the examples of this strong handshakes, right? I was really surprised to see, and after US, when I came back after almost 8.5 years, I was a bit bothered by the whole idea of handshakes in Central Asia, when you should shake like hands of, I don't know, 15 people if they're greeting you. And interesting that it's almost disappeared in Astana in March, in April and May. And interesting to see that it's the handshaking returned back, let's say August, September. I mean, people started to shake hands again with no gloves, you know, like, and men actually started to do this, you know, like, that's, and I saw like sometimes people feel really unpolite, like you greeting them and people feel a bit ashamed because this is like a traditional, I don't know how to say, traditional like way of masculine behavior, you know, like, I don't know, like against Kazakhs, Muslimness, and people started to shake hands again. Even taxi drivers try to shake your hands. It's pretty interesting. So, yeah. Mira, I think so. I saw Mira Kojakhmetova raise her hand. Yeah, please. Yeah. Mira, can you hear us? Yeah. Okay.
Hello, everyone. I just have a comment about the. We didn't talk maybe today, but have you observed something that was connected to the racism in connection with the COVID? Because at the very early stage of COVID in Kazakhstan, I encountered some very interesting cases when one wedding was not canceled, but almost last moment was transferred to another restaurant because initially it was booked for Chinese restaurant. And also I heard about cases when the Chinese owners of small shops in Europe, people stopped going there and stopped buying things from them. So do you have you encountered something like that, or did you cover it in your researches? What do you think about this? I think it's a question to everyone.
I can start this a little bit with my research. So my paper talked about a couple of different types of racism associated with the mask wearing. Initially, a lot of, of course, there was a wave of sort of racist behavior towards Asians in the beginning, that they somehow carried COVID. So a lot of the groups that actually ended up making masks and distributing masks were Chinese American associations. So this was sort of to, kind of counter the idea that they were not productive citizens, that they were somehow, purveyors of the masks. Some of the hoarding that was happening, or the overbuying of masks initially in the United States, were Asians who, like Chinese American citizens or Chinese immigrants, who were buying up masks in the US to mail back to their family in the areas near Wuhan. So part of the lack of masks that existed in the United States was Asians. Last thing, and this is not related to Asians, were Hispanic and African Americans saying they did not want to wear masks because if they showed up wearing masks, they would automatically be seen as criminals. They were already seen as having criminal bodies and embodying a criminal self. And so the addition of a mask, and actually during the pandemic period, the early period especially, there were videos on social media showing, African American security guards because they were wearing masks, and maybe nobody else in the store was following pandemic protocol. So not just against Asians, but other effects related to mask wearing. And I will give the floor over to others.
It's a small anecdote, and I don't believe that I should extend that to general deaf, but I have two deaf friends who keep at, well, first of all, the personal one-on-one communication is really important. So they've been organizing and inviting me to come to various events, picnics, dinners, housewarmings, social gatherings at cafes, child birthdays. I've been invited to all these deaf events. And everybody doesn't have the mask on, and it's useful because even though they're signing, there is lip movement and facial grammar on the face. So I have a couple of deaf friends who are participating in all these events, and I'm kind of, sometimes I go, sometimes I don't go because I don't want to be exposed, but I want to still be sociable with these deaf friends. But a couple of deaf friends have said, Marilyn, do you know any deaf that got COVID? I think there's no deaf that got COVID because we don't talk with our mouths, so we don't spew out the virus like the hearing people. So it's safe to hang out with deaf. And so it's kind of in group, like we're protected by our specificity of not voicing and not singing and not shouting. So it's just a little bit related. I mean, it's really an anecdotal thing, but I've had more than one person make that comment to me from the deaf community. So.
Thank you very much.
You know, I don't have much to add, and I think on top of what Heather and Marilyn have said, the question got me to thinking about not necessarily racism, but the way different groups of people have become viewed in different places. So I am right now in the Canary Islands in Spain, and it's very heavily dependent on tourism. And most people here, most of the locals, at least from my own personal anecdotal observation, are very keen on wearing masks. You almost never see a local, at least a local that I perceive to be local, not wearing a mask. When you do see someone not wearing a mask, they tend to be a tourist, and specifically a British or a German tourist. So there's this kind of feeling, and I must confess I've developed it a bit, where you tend to have a greater trust in maybe the locals than these tourists. Part of that could be because they're tourists. I think that's probably a phenomenon that's going on in many places where tourism is still happening to some degree, that the tourists are there on vacation, they don't want to be wearing a mask. And I'm actually hoping to do some research on kind of what the impact on tourism has been. And one of the things I want to look at is sort of this dualism that local places have had to deal with, where they want the tourists to come, especially places where that's a large part of their GDP, but there's some concern that they're bringing the virus, and that when people are on vacation, I mean, we all act crazy on vacation even without a pandemic, right? So with a pandemic, that kind of thing is still going on and maskless. So it's not specifically about race, but it did get me to thinking about other groups of people where kind of your vision of them has changed as a result of all of this.
Okay, please, anyone would like to add or would like some, do we have questions? Someone would like to. Hello? Michael, should we maybe
I think if folks don't have any questions, you know, I always feel accomplished if nobody has questions.
okay.
Probably assume they're being shy, but you know, part of me wants to say, oh, well, I've done my job then. No, if there's no last minute questions from folks, then I guess we can go ahead and wrap it up. But if anyone has any questions, we're certainly happy to entertain them.
Michael, can I make a last comment that kind of relates to both what Noha and Gavin were talking about? And even Marilyn and you, I mean, the idea, well, of course, my paper is about masks. And Gavin asked about the idea of getting people to change their behavior if it's deeply ingrained in their identity. And of course, this relates to Noha's idea of, you know, some people cover because it's of course part of their identity and part of their dedication to, you know, their spirituality and their God and you know, that sort of thing. I don't believe we would ever reach. I think unless there were punitive measures and they were applied, you know, the idea of getting people to do this, whether people are around or not, I wonder if that would ever happen. I wonder if we would reach ever, you know, a high percentage, especially in countries where they are democracies and people are given choices. And maybe in Egypt, where, you know, the idea of completely covering is seen as something backwards, you know, and the idea of being able to be open, I am doubtful that it would actually happen, no matter how we spin it as the best thing for everyone. And I would wonder what you all would say. Do you expect ever that this would be done by everyone, or even what percent? I mean, 55 is high in a few months. 95, I just don't see it happening in the US. So, Ulan, Nohap, Marilyn, Michael.
You know, I was just at my friend Andy in Paris. I mean, the people in Paris they can't even walk in the street without a certificate. So Andy, are you there? Maybe, how is the mask wearing going in France? Does everybody comply, or how does it work? Because I mean, it's so strict. You have to have your certificate to walk in the street after 6 p.m.
Right, right. We're allowed to go out until 6 p.m. and then we turn into pumpkins. But
But what about mask wearing? Does everybody wear a mask when they go in the street?
almost everybody wears a mask. In the metro, it's obligatory. In public transportation, in the stores. So most people are wearing. Every once in a while you find somebody tries to defy the system and say, I don't need a mask. And then there are those who believe in the conspiracy theories that you mentioned, Heather. And they don't believe it's necessary, but if, you know, you have to wear a mask, and you can get fined if you don't have one, I believe. You can definitely be fined 135 euros, which is maybe $145, if you don't have your certificate that you filled out for a valid reason to be out of the house after 6 p.m.
Yeah. And it's presumably, if you're out of the house, you're wearing your mask because you're already contravening
Yeah. It's for
the
other
rules of the
people. You want to, you know, preserve other people, but also yourself. So it's for both. So. And the masks have changed, because before we could wear cloth masks, and now they are telling us not to wear cloth masks because they don't protect people enough. So we either have to wear surgical masks, or even better, there's another kind that's sort of like a surgical mask, but it's thicker, that you buy in a pharmacy. It's more expensive. So most people are wearing those kind of masks that you throw away. And the cloth masks, for example, in schools are banned now. The do-it-yourself masks that people made at home. So we'll see what happens.
Thank you for your contribution.
Thank you for inviting me. Yeah, that was very interesting. Everybody was very interesting.
Yeah, and maybe I would like to add that probably the highest shock in Kazakhstani society probably was like summer, June, July. But I would say like then it's, this like reminds me of some memories of World War I or World War II. That death becomes something usual. For example, in May and June, people were telling about like coronavirus deaths, but I mean, maybe it's very cynical, but people kind of like get, okay, yeah, there is relatives dying, people are dying. What we can do, and economic hardship, they actually probably even disturbing people more than deaths of people, to be honest. And I think we discussed it before that actually it's interesting to look to Nur Sultan, and there is suburbs of Nur Sultan, and large amount of food and etc. coming from suburbs, and large chunk of people actually coming to they living on a daily wages which they got, you know, like I mean, like this is a similar happened in India when Indian government, India like enters this like special working hours prohibitions, etc., and suddenly people just left without money to survive. And my impression that the number of, for example, Yandex, so with this like the analog of Uber drivers suddenly increased. The high level of unemployment and people really started to think more about like daily survival needs than about like deaths or getting coronavirus or like wearing a mask or not wearing a mask. And my impression is that now like people, they keeping a mask but they keeping it like that. This is very interesting. Yes, even if I will be stopped by police, I always can say I'm wearing a mask, but actually I do it like that for the whole day, I mean, and now it's minus 25, minus 30 outside, and wearing a mask, especially with a glass in the middle of Siberian steppe, it's not comfortable at all. So, and I think it may be even dangerous for your lungs, but who knows? I'm not a doctor, but actually it's interesting to see. I mean, it's horrible in many ways that actually like the pressure of this neoliberal capitalism actually kind of push people, I mean, to kind of more cynical, I don't know, more kind of ways. Yeah. So. Yeah. Okay. Should we wrap up our
Yeah, I think unless there's more questions, let's go ahead and wrap it up. Let me just wrap it up by saying thank you to everyone for coming today. Thank you to Ulan and to Karina for helping to organize this, for letting us come and speak. And the most special thanks to Heather, Marilyn, and Noha for your presentations today, which I thought were great. And also for your chapters, which I had the privilege of getting first access to, and we're all just absolutely wonderful. And I have to say, I've been looking at the work of the other presenters since they were in their first drafts, and since I think early last summer, I've been looking at them, and I've seen a couple of them speak a couple of times, and every time I learn something new. So I really appreciate you guys coming today. I'm sure the audience does as well. So I think it was great. Thanks to everybody.
Okay, thank you very much. Thank you. So let's meet maybe next seminar. Okay. Thank you, Marilyn, Peter, Noha, Michael. Thank you. Bye.